Hello, my name is Tori Simpson, and here is my ID. Today, I'm going to be doing a presentation on the interrelationship between periodontal disease and diabetes. As a dental assistant, I have frequently seen patients being diagnosed with periodontal disease 6 months to a year after being diagnosed with diabetes. The frequency of these two conditions being diagnosed roughly around the same time made me think that there's a connection between the two that's more physiological rather than just by coincidence. So I did a little bit more research. Periodontal disease or periodontitis is a serious infection that causes inflammation and destruction to the structures surrounding the teeth. It is a progressive infection that begins with poor oral hygiene. Now, when good oral hygiene is practiced, the results include a regulated balance between good and bad bacteria, healthy gums that are pink and without inflammation, and tooth stability due to bone levels. Good bone levels. When oral hygiene is neglected, plaque and food debris build up a biofilm on the teeth and the gums. A state of imbalance between good and bad bacteria, referred to as dysbiosis, occurs and starts a progression or a progressive reaction. When the biofilm buildup is not removed, it hardens and forms calculus. The calculus can wedge between the tooth structure and the gingival tissue, creating a space where bacteria can enter the gingival sulcus. Once this occurs, the gingival cells trigger an immune response, where neutrophils, lymphocytes, and macrophages are sent to the area. The immune cells release chemicals that kill bacteria, but also damage the surrounding tissue cells, causing inflammation. The condition is considered gingivitis. And at this stage, in the progression, it can be reversed with proper oral care and professional dental cleanings. However, if changes are not made, that damage will progress to periodontitis, also known as periodontal disease. At this stage, the process of dysbiosis is more extreme. The increased pathogenic bacteria within the subgingival space creates a periodontal pocket. This is due to the mast cells and nerves releasing histamine and substance P, which causes dilation of local blood vessels, resulting in swelling gingiva. The damaged gingival cells release additional cytokines, more lymphocytes, more macrophages, more neutrophils, along with osteoclasts. Now, the osteoclasts start to dissolve the bone that surrounds the tooth structure. This causes more damage to the gingiva, more damage to the periodontal ligament and the surrounding bone structure, resulting in tooth mobility. Here we see two examples of patients. The first patient at the top left is an example of a patient who is practicing good oral hygiene. You can see that the bone levels surrounding the teeth cover about 2/3 of the tooth structure, which creates the ideal stability for the teeth. Whereas the second image on the bottom right, the bone level is significantly lower, covering only about 1/3 of the tooth structure, which results in tooth mobility. This radiograph, or both of these radiographs, are perfect examples of why once you reach the stage of periodontal disease, it's irreversible. Once that bone level is gone, there is no getting it back. It's just about maintaining at that point. So what about diabetes? Well, diabetes is a chronic disease that affects your body's ability to process sugars. Diabetes can lower the body's ability to fight infection and slows the healing process, which leads to the increased number of harmful bacteria in the mouth. Infection can cause, such as periodontal disease, can cause blood sugars to rise. So as we see, these two conditions are linked because gum disease makes diabetes harder to manage and unmanaged diabetes increase the risk of periodontal disease. Since the two conditions are linked, it is very important to manage both diabetes and periodontal disease. Patients can accomplish this by maintaining good oral health, by flossing at least once a day, brushing 2 times a day, attending regular dental checkups and cleanings every 6 months, managing their blood sugars, eating a healthy, balanced diet, and having regular checkups with their primary physician. Even though these two conditions feed off of one another, patients can still manage their health by taking these necessary steps that can slow or even halt the progression. Thank you for listening. I hope you learned something today.